Pompholyx, also known as dyshidrotic eczema, is a skin condition that causes small, itchy blisters on the hands, feet, or fingers. The condition is often chronic, and while there is no cure for Pompholyx, there are several treatment options that can help manage the symptoms and prevent flare-ups. In this video, we will introduce the Pompholyx overview, causes, signs and symptoms, who is at risk, diagnosis, complications, treatment options, and home remedies. By the way, welcome to our channel. Don't forget to thumb up and subscribe. Signs and symptoms of Pompholyx. Pompholyx typically presents as small, itchy blisters on the hands, feet, or fingers. The blisters are usually filled with clear fluid and can be quite painful. The affected skin may also be red, inflamed, or scaly. The blisters may be more pronounced during flare-ups and may persist for several weeks or months before healing. Other symptoms may include small, itchy blisters on the hands, feet, or fingers. Blisters may be filled with clear fluid. Redness and inflammation around the blisters. Skin may be dry, scaly, or cracked. Itching or burning sensation in the affected areas. Pain or discomfort in severe cases. Blisters may break open and form crusts. The skin may become thickened or hardened with repeated flare-ups. Pompholyx causes. The exact cause of Pompholyx is not known, but several factors are thought to contribute to its development. These factors may include allergies. People with a history of allergies, such as hay fever, may be more prone to developing Pompholyx. Irritants. Exposure to certain chemicals, such as detergents or solvents, may irritate the skin and trigger a flare-up of Pompholyx. Stress. Emotional stress or anxiety can also trigger an immune response in the body, which can lead to skin inflammation. Sweating. Excessive sweating or exposure to hot, humid conditions may also contribute to the development of Pompholyx. Fungal or bacterial infections. In some cases, Pompholyx may be triggered by an infection caused by fungus or bacteria. Genetic factors. Some people may have a genetic predisposition to Pompholyx, as the condition tends to run in families. In traditional medicine, it is believed that dermatitis is caused by damage of the balance of the body's organs' natures, especially the skin nature, which is affected by various internal and external factors. So, who is at risk? Pompholyx can affect people of all ages, genders, and races. But there are certain risk factors that may increase the likelihood of developing the condition. These risk factors include age. Pompholyx most commonly affects adults between the ages of 20 and 40. Gender. Women are more likely to develop Pompholyx than men. Allergies. People with a history of allergies, such as hay fever or asthma, may be more likely to develop Pompholyx. Atopic dermatitis. People with a history of atopic dermatitis, a chronic skin condition, may be more likely to develop Pompholyx. Exposure to irritants. People who work with chemicals or have frequent exposure to irritants may be more likely to develop Pompholyx. Stress. Emotional stress may increase the risk of developing Pompholyx in some people. Sweating. People who sweat excessively may be more likely to develop Pompholyx. It is important to note that having one or more of these risk factors does not necessarily mean that a person will develop Pompholyx. Anyone can develop the condition, regardless of their risk factors. How to diagnose Pompholyx? Diagnosing Pompholyx typically involves a physical exam and a review of the patient's medical history and symptoms. The healthcare provider will look for the characteristic small, itchy blisters on the hands, feet, or fingers and any redness, inflammation, or other signs of skin irritation. A skin biopsy may be performed to rule out other conditions. In some cases, blood tests or allergy tests may be ordered to help identify any underlying causes or triggers of the condition. It is important to differentiate Pompholyx from other skin conditions that may have similar symptoms, such as contact dermatitis, fungal infections, or psoriasis. A proper diagnosis by a healthcare professional is important before starting any treatment. Treatment options for Pompholyx. Treatment for Pompholyx typically involves managing the symptoms and preventing flare-ups. Treatment options may include topical corticosteroids. These medications are applied directly to the affected skin to reduce inflammation and itching. Emollients. Moisturizing creams or ointments can help soothe and hydrate the skin, reducing the risk of flare-ups. Topical calcineurin inhibitors. These medications can also reduce inflammation and itching and may be prescribed if corticosteroids are not effective, or if long-term use of corticosteroids is not recommended. Oral antihistamines. These medications can help relieve itching and may be prescribed for severe cases. Phototherapy. This treatment involves exposing the skin to controlled amounts of ultraviolet, UV, light to reduce inflammation and itching. Immunosuppressant medications. In severe cases, immunosuppressant medications may be prescribed to reduce inflammation and prevent flare-ups. Antibiotics. If the skin becomes infected, antibiotics may be prescribed to clear the infection. It is important to note that treatment may vary depending on the severity of the condition and the individual's response to treatment. Some people may require a combination of treatments to manage their symptoms effectively. Pompholyx home remedies. In addition to medical treatment, there are several home remedies that can provide relief for Pompholyx. These remedies may include soaking the affected area in cool water to reduce itching and inflammation. Applying a cool, damp cloth to the affected area for a few minutes at a time. Applying calamine lotion to the affected area to reduce itching and dry out the blisters. Avoid exposure to irritants, such as chemicals or detergents, that may trigger a flare-up. Keeping the affected area clean and dry to prevent infection. Wearing gloves or protective clothing when working with irritants or chemicals. Avoiding scratching the affected area, which can cause further irritation and may lead to infection. It is important to note that while home remedies may provide relief, they are not a substitute for medical treatment. If symptoms persist or worsen, it is important to seek medical attention. By working with a healthcare provider and taking steps to manage symptoms, people with Pompholyx can lead a comfortable, healthy life. Thanks for watching. Take care and stay safe.